Welcome to this second edition of This is Public Health, a podcast presented by the Illinois Department of Public Health. Each week, we are focusing on an area of public health and programs and services that affect you. We're very pleased this week to be joined by Dr. Mona Van Kanegan. She's the chief of the oral health section at the Illinois Department of Public Health. And Mona, thanks so much for being here with us. It's great to talk to you.
Oh, it's my pleasure, Jim. So thank you for the invitation.
I'd like to begin with just getting an overview of the oral health section. What is it you do? What are your primary areas of focus?
Sure. So, we all know that the mouth is the gateway to the body. And a lot of times, we forget that. Even the healthcare system forgets. And we know that it's necessary, obviously, for eating and drinking, speaking, and other daily activities. So when problems occur in the mouth, it can really affect your social life and your ability to attend to your schoolwork, to your work, maintaining a proper diet, and all of those things. So, it can impact day to day and our long-term physical, mental health. And that's why I think IDPH really sees oral health as a key initiative or a key issue for the public. So for the oral health section, what we do is we do a lot of connecting to the various aspects within IDPH, within the healthcare space. And our focus is to improve oral health status through our key activities, which are to increase access to care, promote self-care, and preventive care. We also work to integrate oral health into other systems of care like primary care. We target a lot of our interventions to high-risk groups. And then, of course, we definitely support optimal fluoridation, which is a state law in Illinois.
This is really such an important point when you talk about oral health as being a key to overall health. We're going to get into that a lot more coming up. But another really important aspect of this is the fact that this is something that people have a lot of real direct control over in their lives, the ability to have good oral health. I know a lot of us have various dental issues to one degree or another. And is it just inevitable we'll deal with that? Or what can we be doing to ensure that we don't have those sorts of problems?
Yeah, really important. Two of the most common oral diseases are tooth decay, or we also use dental caries or dental cavities, and periodontal disease or gum disease. Even though they're very common, they're actually almost completely preventable. The challenge is that it takes daily action, consistent daily action, good oral hygiene, and then from time to time, professional assessment, because once in a while you do need to have something checked out by a trained professional. So, I think the challenge for many people is, number one, they might not know that it's actually a bacterial disease, these dental caries and periodontal disease, and they can do something about it. But it does, again, as I said, require daily action. And it's not just like brushing and flossing. It's like brushing for 2 minutes, making sure you're getting all over in the mouth, flossing, with whatever aid that you could use to get the bacteria out from in between your teeth and near the gum line. So, concerted action and highly preventable.
And you mentioned the need to have intervention from time to make sure that you're getting those regular dental checkups and things. How easy is it to get that? And how does IDPH work to ensure that people have access to that kind of care?
Sure. Well, in a lot of places in Illinois, we have what we call a dental health professional shortage area. So not enough dentists for the population that resides in that area. And so what we try to do is we try to promote and create access, like self-care essentially, and increase access by training community health workers, for example, on the basics of oral health so that they could share that information with their family members, their friends, their colleagues. Because again, as I said, highly preventable bacterial infection, but people actually don't know that it's actually a bacterial infection and that they can prevent it. So, we spent over the last few years, we spent significant time on our community health worker initiative, trained over 400 community health workers across Illinois on the basics of oral health and how they could use that information, not only for themselves, but help navigate people into care settings, for example. We have a lot of oral health grant funding that gets distributed through local health departments and FQHCs. And they work through Head Start and Women, Infant, Children programs, elementary schools and high schools, again, with a health promotion focus and a prevention focus. Because we know Even though it's highly preventable, we still need that regular professional assessment and from time to time, disease controlling treatments.
You're listening to This is Public Health with the Illinois Department of Public Health. Our guest today, Dr. Mona Van Kanegan, Chief of the Oral Health Section at IDPH. You have talked at length a lot of different ways that people can have better overall oral health, and some of your suggestions have included getting enough sleep, staying active. What do those things have to do with oral health?
Getting enough sleep and staying active decrease stress. Stress can impact teeth, your jaw joints by your grinding your teeth or clenching, and those actions can damage teeth and or the jaw joints. So really important to kind of work on stress, decreasing stress. And a lot of times people can do that by making sure that they get enough sleep, good quality sleep too. And then of course, staying active as much as possible. So sometimes the worst things that happen to us are things that we do to ourselves while we're sleeping unconsciously or subconsciously.
We talked a little bit earlier about this notion of access to care. And for a lot of us, it's something we just take for granted. We go see the dentist a couple of times a year. It's just part of the regular routine. It's not that simple, though, in some parts of Illinois. What do we know about access to care, availability of dentists in certain parts of the state? And what is IDPH doing in response to that?
Yeah, Jim, I'm going to have to nerd out. I'm sorry. I have a lot of data in my head and a lot of data that we're putting out from the oral health section. So, overall, in many parts of our states, it's really challenging for people to get needed dental care, especially in a timely way. There's a great imbalance between the burden of disease, i.e. cavities, periodontal disease, oral cancer. Those are the main ones. And providers willing and able to provide this disease treating care. I'm going to give you some data now, so please don't tune out. A few of the things that we track is in 2018, 2019 data, a little bit old, but we're updating this year. Our Healthy Smiles, Healthy Growth Survey, which is a third grade survey of Illinois children across the state, showed that 22% of Illinois third grade children have untreated tooth decay, i.e. bacterial infection in their mouth that needs to be treated. Of course, this is just statewide data. There's large variation when examined by race, ethnicity, and or geography. Another piece of data, from 2022 for Illinois, the National Health Interview Survey report that, almost 15% of adults who needed dental care did not get it because they could not afford it. Another piece of data, this is average over 2018 to 2022, an average of 84 out of 10,000 adults use the hospital emergency room for a dental problem. Again, huge variation in this data when you examine it by race, ethnicity, or geography. So you could look at some of this data on our webpage. And the last thing I want to point out that in 2022, only about 45% of Medicaid enrolled children received even one dental care visit. So many counties in Illinois are challenged with accessing care and getting timely care. And there are things that we could be doing, and Illinois is doing a few of those things. A lot of this is workforce issues. So Illinois actually has 3 different workforce initiatives besides the community health worker that I mentioned that really impact the oral health team. We've got many dentists that receive federal loan repayment programs, and that actually applies to both dentists and dental hygienists. So these are places where dentists would work in a shortage area. I myself was one of those dentists. I worked in a shortage area and was the recipient of the federal loan repayment program. And it actually took me about 5 years to pay off my loans, but I stayed with that health center for almost 20 years. This is before I came to IDPH. Illinois, actually, through our Center for Rural Health, oversees a state loan repayment program. And this is focused for dentists only. They have to work in health profession shortage areas in Illinois. And the last workforce thing that I wanted to add was a new act that was signed called the Equity and Representation in Healthcare Act. So this act is different and unique because it will provide scholarship and loan repayment for providers who locate in areas of greatest need. But for the first time, these funds can be used to support education of dental assistants who are key people and part of the oral health team. So, not only do these federal state programs cover dentists and dental hygienists, but now dental assistants, which is huge, I think, which is a great piece of legislation.
What an important way to help these underserved areas, but also to benefit these professionals who have put so much time and money into their education to develop these skills, to be able to get some relief from the loans and things they've racked up. Where can people go for more information about these programs that are so mutually beneficial?
If you were to Google National Health Service Corps, you can get information about the federal loan repayment program. If you Google Center for Rural Health State Loan Repayment Program, you'll land on their page. And way at the bottom of the page is a fact sheet, which is super helpful. And then I think the Equity and Healthcare Act, the rules are being developed for that process. So I don't think those have been published yet. So that is an in-process thing. I contributed to so that we made sure that dentists, dental hygienists, and importantly, dental assistants were writing of the rule.
Talking with Dr. Mona Van Kanegan, Chief of the Oral Health Section of the Illinois Department of Public Health. I want to circle back to what we began with, talking about oral health as a key to overall health. And if you could talk a little bit more about that link, if someone has these ongoing dental or periodontal problems, what are the long-range implications for their overall health and well-being, and how can one lead to complications in the other?
Periodontal disease, is a chronic inflammatory condition that has its origin in bacterial infection. So this infection, even bacteria and or the inflammatory markers that result in this infection, can travel to other parts of the body, distant sites. And there's actually growing evidence suggesting a link between periodontal disease and other chronic illnesses like cardiovascular disease, diabetes that you mentioned, rheumatoid arthritis, even Alzheimer's disease. So a lot of connection through this traveling of bacteria from the mouth to other parts of the body, or traveling of these inflammatory markers, which, are a result of the periodontal disease, to other parts of the body. So, for example, I can get into more detail around maybe cardiovascular disease. So, the local infection in the mouth releases these markers. A couple of them are the C-reactive protein, or CRP, or interleukin-6. These are released into the bloodstream. Elevated levels of these markers have been associated with the risk of cardiovascular events. That's one kind of connection between periodontal health and body health. Another is actually diabetes. There's a lot of evidence around the connection between good oral health and diabetic control, or poor oral health and uncontrolled diabetes. Again, back to the bacterial infection. The bacteria travel to other sites, trigger systemic inflammation, which can increase insulin resistance and lead to poor diabetes control. This is a bidirectional relationship. Yeah. So if you are managing your diabetes well, then actually your periodontal health can get better as well.
We are almost out of time, but at the beginning, we talked about how these issues are preventable with appropriate daily care and regular checkups and things. The other question that comes to mind is, are these conditions reversible? If someone's had long-term or chronic oral health issues, they may feel like, I'm just too far gone here. But can you, in fact, reverse this process and start to see greater health benefits overall by addressing some of those needs, even if you've had them for a long time?
With periodontal disease, you can control the active phase of the disease. You're not going to be able to regrow bone. There are some treatments now where you can get bone grafts and things like that. But, it is a irreversible process, but you can control it. It can be treated. It's never too late to improve your oral health. You're really investing in yourself when you do that. And of course, with cavities or dental caries, you're taking out the diseased tooth and you're just replacing it with some artificial material. And so you are controlling it in that way, you're treating it in that way, but you need to, again, be maintaining it so that you don't get what we call recurrent caries or reestablishment of the periodontal disease. The first step, I think, to improving your health is to learn and be aware of what's going on in your mouth and what you can do and what your professional can do to help you maintain your oral health. Because as we talked about today, there's a lot of connection between your mouth health and your body health. So taking care of your mouth is important. And I think the rest of your body will thank you for that.
We encourage you to go to DPH.illinois.gov, search for oral health to learn more about these important issues. In the meantime, Dr. Mona Van Kanegan, Chief of the Oral Health Section at IDPH, thank you so much for joining us here. We do appreciate your time.
It was my pleasure.
Join us next time for another edition of This is Public Health with the Illinois Department of Public Health.